In this video, we'll learn how to properly identify the individual vertebrae types, and in our next video in the series, we'll identify the unique landmarks in detail. First, starting with the cervical vertebra, that is C3 through C7, it's helpful to know what makes them different. First, they're going to be our smallest vertebra because they're holding up less weight. As you go down the spine from the neck to the middle back and then into the lower back, notice how the vertebrae gradually get larger. So our cervical vertebra, they are unique in that they have bifurcated spinous processes here in the back. They also are unique in the fact that they have three different holes to them. We have 1, 2, and 3 holes here. So the two off to the side are our transverse foramina, which transmit blood vessels, whereas our vertebral foramen here in the back is going to transmit none other than the spinal cord. If you also look at the vertebral body here, notice how it has this saddle-like shape to it right here in the front. If you look at the vertebral foramen as well, notice how it is triangular in shape as well. So those help you identify it as a cervical vertebra. Moving on to the thoracic vertebra, if you look at it from the back, many students look at this vertebra and see a giraffe, in that we have a long spinous process for the nose that's pointing downward. The transverse processes to the sides are the ears, and the superior articular processes and facets are this ossicone-like cartilage, which are kind of like horns for the giraffe. The vertebral body itself is heart-shaped, and the vertebral foramen in the middle here is circular, and it's rather small in comparison to the other vertebrae. Now in the lumbar spine, the vertebra, when viewed from behind, they can sometimes be described as looking like a moose or a deer head, in that the spinous process right here is like a rather large nose or rostrum for the deer or moose head, as well as the transverse process and the superior articular process on both sides are kind of like the ears or the antlers. When you look at the vertebral body from above, it's overall has this kidney bean shape to it, and looking at the vertebral foramen right here, notice how it's triangular shaped overall. Going back to our cervical vertebra, we have to distinguish between C1 and C2 as our atypical cervical vertebra. Now, C1 is also known as the atlas because it's commonly depicted by the Greek Titan who was condemned for all eternity to hold up the sky above his head. Therefore, it's modeled oftentimes as that Greek Titan holding up a round sphere. In anatomy, in this case, C1, the atlas, is holding up the skull, a round sphere. Now, it's also really unique in that this vertebra, C1, does not have a vertebral body like the rest of the vertebrae do. And instead, it has an anterior as well as a posterior arch to it. And it still has the same typical features as 3 holes, the transverse foramen, as well as the vertebral foramen here. Now, C2 is also known as the axis. Now, why do we call it that? And it comes down to this structure right here, the dens, also known as the odontoid process. So C1 sits on top of C2, and that dens allows C1 to rotate on an axis. So this vertebra is our axis. Now it also has the same typical features of the cervical vertebra in that it has the 3 holes to it, transverse foramen on each side, as well as the vertebral foramen in the middle. Now, why are these two vertebrae so drastically different, and specifically in their shape or volume? And it comes down to the fact that when these two bones were in development in an embryo and later on a fetus, essentially the vertebral body of C1 was stolen by C2 right here. So this dens or odontoid process technically was a part of C1 during development, but it later fused with C2. Now in the next video, we'll go over the individual landmarks of each of these bones in detail, and then the final video in this series, we'll have a quiz and be able to identify the individual bones as well as the specific structures.